Assalamualaikum and hi everyone. So today me and my team are going to talk about PA epi projection for scoliosis. My name is SOFEA binti OSMAN and I will start the presentation video with the technical factors that need to be considered in this projection. The first thing is the SID. SID is between 100 cm to 150 cm. The second is the size of image receptor. The size is 35 times 43 cm or 14 times 17 inch. The orientation of the cassette is in lengthwise. Not only that, grid also required in this projection. For the exposure, in analog, the exposure is between 80 to 85 kbp, while in digital system, it is 85 to 95 kbp. For the MAS, it is 40 to 60 MAS. Erect marker for the erect position. Last but not least, the breathing instruction is suspended expiration. That's all from me, and the presentation video will continue by other teammates. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is ELLISERINA and I'm going to present about patient positioning. The patient positioning for PA scoliosis has erect and recumbent position. Firstly, as a radiographer, we need to make sure that patient has removed all the jewelries and accessories such as belts, innerwear, or any material that can be seen or can be imaged when X-ray is taken. Patient may also wear gown that has been prepared at the X-ray room available. When patient is in erect position, patient will stand upright with their back facing towards the X-ray tube and their face is toward the image receptor. We need to make sure that the feet are shoulder width apart to provide stability and the probability if the patient will lean. The head of patient should be in a neutral position, facing forward without tilting to any side. Weight are also evenly distributed on both feet for balance. Patient posture needs to be natural but upright to avoid any slouching or exaggerated extension of the spine. Also, the arm should be put by the sides of the patient.
Hello, my name is SHAZWIENA binti Muhammad Safari and my matrix number is 079501. So today, I will be explaining to you guys about part position in PA epi scoliosis projection. There are 3 points that I will tell you guys. The first one is you must align the mid-sagittal plane to the central ray and midline of the table or IR, image receptor. The second one, you must ensure that there is no rotation of thorax or pelvic axis if it is possible. Scoliosis may result in twisting and rotation of your vertebra. Making no rotation is unavoidable. And lastly, please place lower margin of image receptor of minimum 1 to 3 inches. It's like 3 to 5 cm below the patient's iliac crest.
I am ZUNNUR SYAFIKA binti Muhammad ZUKIFLI. I am going to explain about the central ray and collimation for PA and episcoliosis. So, for central ray, the cassette needs to be centered so that the bottom edge is at the level of axis. Direct the central ray perpendicular to the center of the cassette. The central ray is directed at the midline of the body, typically at the level of T7, which is the 7th thoracic vertebra. This is roughly at the level of the inferior angle of the scapula. So for the collimation, the field should extend from the base of the skull to the level of the sacrum. Superiorly, all relevant vertebrae starting at the cervical spine needs to be included. Inferiorly, The sacral area at the level of femoral heads or at S1 needs to be included. This ensures that the entire spine is visualized in the radiograph. For horizontal collimation, the field should include the lateral margins of the thorax. This ensures that any lateral curve of the spine is fully captured. Proper collimation and central ray alignment are crucial to ensure that the entire spine is captured without unnecessary radiation exposure to other body parts.
Assalamualaikum warahmatullahi wabarakatuh. I am SITI NURSYUKRIAH NASUHA binti Muhammad SUKRI, and I am going to present about the radiography image of AP scoliosis. First, a good radiographic image of AP scoliosis must include the thoracic and lumbar vertebra, including 1 to 2 inches of iliac crest inside the film. If we go through the sample photos that we have here, we can see that the thoracic and lumbar vertebra as well as the iliac crest are seen in the images. Next, we can tell whether there is spatial rotation or not by looking at the thoracic and lumbar vertebra with spinous process are aligned with vertebral midline, and also the iliac crest is symmetrical with upper sacrum. So from the second image that we paste here, we can clearly see that the spinous process with the thoracic and lumbar vertebra are aligned with the vertebral midline, and the iliac crest is symmetrical with the upper sacrum. So there is no patient rotation in this image. However, scoliosis is often accompanied by twisting and rotation of involved vertebra. Lastly, the clear demonstration of bony margins and trabecular markings of thoracic and lumbar vertebra are important to make sure that the exposure used are correct. So we can see very clearly on the second photo that the bony margins and its trabecular markings are very visible, so the exposure used for this radiographic image is practical. That's all from me. Thank you.